cover test assesses the presence or absence of the patient's motor fusion ability. There are two kinds of methods, which are cover-uncover test and alternating cover test. Cover-uncover test to differentiate between tropias and phorias and determine if tropia is alternating and unilateral. Alternating cover test is to determine the direction and the magnitude of a tropia and phoria, but does not differentiate a phoria from a tropia. Firstly, have the patient to look at the target and keep it clear. Cover the patient's right eye and look for the movement of the left eye. If there is no movement, it indicates the left eye was fixating on the target at the start of this test. Repeat the step 2 or 3 times. Then, do exactly the same thing for the left eye. And now, cover the patient's left eye and look for the movement of the right eye. If there is no movement, it indicates the right eye was fixating on the target at the start of this test. Repeat the step 2 or 3 times. Firstly, have the patient to look at the target and keep it clear. We will place the occluder in front of the patient's right eye for 2 or 3 seconds. Quickly move the occluder from the patient's right eye to the left eye. We will observe the right eye for the direction of movement and the moment it is unoccluded. Firstly, have the patient to look at the target and keep it clear. Cover the patient's right eye and look for the movement of the left eye. And now, cover the patient's left eye and look for the movement of the right eye. We will place the occluder in front of the patient's right eye for 2 or 3 seconds. Quickly move the occluder from the patient's right eye to the left eye with the left eye.
The normal value or expected finding of the cover test is orthophoria at distant and exophoria at near. Based on figure A, we can observe that there are movement of the left eye when the right eye is occluded. The direction of the movement is from nasally toward the center. This is called left eye isotropia. Based on figure B, we can observe that there are movement of the left eye when the right eye is occluded. The direction of the movement is from temporally toward the center. This is called left eye exotropia. Based on figure C, we can observe that there are movement of the left eye when the left eye is occluded. The direction of the movement is from the center toward the nasally. When the left eye is unoccluded, the left eye moves back toward the center as the initial position. This is called isophoria. Based on figure D, we can observe that there are movement of the left eye when the left eye is occluded. The direction of the movement is from center toward the temporally. When the left eye is unoccluded, the left eye moves back toward the center as the initial position. This is called exophoria.